Dr. Brown, can we go ahead and get the vitals?
Sure, of course. Mr. Jones, overnight you had no fevers. Your blood pressure ranged between 120 and 140, over 50s to 60s. Your heart rate was a little high though, it was about 100 to 110. And your respirations, you were breathing a little bit more than normal, about 21 times per minute. And on room air, you were only getting about 90% oxygen in, and on the 2 liters of oxygen, which is what you're on now, you're up to 97%.
Great. How about the labs from this morning?
Sure, the labs from this morning, his white count's a little elevated at 17. Otherwise, his hemoglobin and hematocrit, Mr. Jones, are fine. Your platelets are fine. The only thing that was abnormal on your renal panel was that your glucose was a little high at 167. That's your sugar.
What have his sugars been ranging?
So overnight, his finger sticks had been a little bit elevated. I think last night before dinner was about 200, and then this morning was about 180 on his finger stick.
So that's been, Mr. Jones, your sugars have been running a little bit high. We're expecting that because we have you on steroids for your lung problems, for your COPD. And so it can make your sugars go up a little bit higher, but we're going to have to get better control of that while you're here. What about any imaging?
Yeah, we have a chest x-ray from last night. This is your chest x-ray, Mr. Jones. And as you can see, your lung fields are enlarged, which is what we would expect in somebody who has a history of COPD. We call it hyperinflation. But other than that, there's no signs of infection, no signs of pneumonia in your x-ray. So that's good.
Great. So any nursing issues overnight? Anything going on?
Mr. Jones, throughout the night you had a significant amount of wheezing in your lungs. You did receive your every 4-hour duo nabs, which is the nebulizers that you get in your mask throughout the night. Your oxygen did range anywhere between 94 and 97% with your oxygen on 2 liters. The one time you did get up to the bathroom, it did drop to 82% when you were not wearing your oxygen. Last night's blood sugar was 270. You got 4 units of Novolog. This morning it was 180. You got 2 units. For a total of 14 units in the past 24 hours.
So 14 units of extra insulin needed to control your sugars. That means your sugars are running too high, and actually we really need to get the glucose down, your sugars down, so that your body can fight off this breathing trouble you're having. Okay?
Yeah, I see. Okay.
So Dr. Gray, what would you like to do with his glucose management?
So I would, if you got 14 units total in 24 hours with the basal bolus, what I want to do is give you half of that, so 7 units just for nighttime, so 7 units of Lantus, and then do 2 units of the short-acting insulin with meals. That way we could kind of cover what your extra needs have been.
So more insulin then?
More insulin for now, yes. Yes.
I think that sounds like a fine plan.
Can we go through the checklist?
Absolutely. Mr. Jones, I'm going to run through a checklist with the team just to make sure that we discuss everything that's really important to your care. Can we review Mr. Jones's medications?
Sure, I pulled them up here. The medications we have you on in the hospital here, Mr. Jones, include those Duonebs, which are the breathing treatments. You're getting those every 4 hours. You're on your amlodipine, which is one of your blood pressure medications. You're on your metoprolol and your lisinopril, which are also blood pressure medications. We have you on your simvastatin, your aspirin, the finasteride, your Lexapro, and since you've been here and we've been holding some of your oral medications for your diabetes, we've been putting you on the basal bolus correction insulin, which is what we talked about earlier. We also have you on the prednisone, and then we started you on an antibiotic called moxifloxacin at 400 milligrams daily as well.
What sort of diet is he on?
He's on a cardiac diabetic diet.
Is that what we want to continue? How about any sort of DVT prophylaxis?
You know, I'm seeing in here we didn't order sub-Q heparin last night, but I can put that in.
And what was your rationale for that?
When he came in, I had anticipated that he would be up and walking around more than he was, but it appears that overnight he was still feeling ill, and so he's been more sedentary than expected. So I think it's appropriate to do sub-Q heparin.
Okay, so Mr. Jones, what we're talking about is starting you on shots a couple times a day that are to keep your blood thin while you're in bed more than usual. And it's to prevent a blood clot.
So needle injections?
Yes. It's sort of like the insulin injections.
Oh.
I know, we're sticking you quite a bit. If you have more questions, we can talk about that. Okay.
Jen, how's his skin doing? Any issues?
On assessment, there was no skin breakdown.
Okay. Any reason for fall prevention?
No.
Does he have a Foley catheter? IV line?
He has a 20 gauge in the right upper arm.
Any other line? And is he on telemetry?
Yes, so we did put him on telemetry.
Do you think he still needs to be on it?
Yeah, maybe not the cardiac, but definitely just the pulse ox. We can change that.
I can do that.
You said he was a little bit more sedentary than you anticipated. Do you think it's time for physical therapy or occupational therapy?
I think right now he's still requiring the do-a-nebs every 4 hours. I don't think he's quite ready yet, but likely tomorrow.
Okay, we'll keep an eye on that. How about education needs? What is it you'd like to focus on?
Well, with your high sugars and your diabetes, I'd like to come back and talk to you about the insulin shots we've been giving you and about your diabetes in general. But we also have a diabetes educator that I think would be good if they came by to talk to you as well, just about managing your diabetes at home.
I won't have to go with any needles. I could continue with the oral type of thing.
Well, we're hoping that that's only for while you're in the hospital, but it's a possibility. So I'll come back later and we'll talk about your concerns and how we can manage those. Okay.
You only don't want any needles.
Okay. We'll talk about it. And also, for his COPD, since we'll be starting him on a controller medicine, I think respiratory therapy should come by and talk with him as well.
So consultations will just be diabetic educator and respiratory therapy. How about his estimated day of discharge?
So at this point, because we're still having a lot of problems with his oxygen and his breathing, I'm going to put him out for 2 days at this point.
And do you anticipate he's going to need anything when he leaves here?
The only thing I can think of, and I'm just thinking ahead, is that maybe he may need oxygen on discharge. I know he was already borderline, perhaps requiring oxygen at home, so that could be a possibility, and we'll talk to you more about that too.
That doesn't mean one of those things I have to carry around, does it?
So potentially.
Yeah, Mr. Jones, if you should require oxygen when you leave here, I'll set that up for you. And they have made it really convenient for people now to be able to get out and about. And so the tanks are very small, and typically you can carry it right on your shoulder in a little pack. But we absolutely will talk about it at your time of discharge. I will make sure that you're prepared to go home and you have whatever you need.
Oh, okay.
Mr. Jones, I can sense some apprehension there, and I just want to ensure to you that we won't ask you to go home with any extra medications or oxygen if your body isn't telling us it needs it. So if your body does much better over the next 24 hours and we can take you off the oxygen,
Right.
then it's a non-issue. We just sort of like to be prepared for what things you might need when you go home, okay? So we'll talk about it again tomorrow.
Okay.
Okay.
When it's time for you to go home, Mr. Jones, who will be able to take you home?
My wife.
Okay. And also to your follow-up appointments, does your wife usually take you to those?
Yes. Or sometimes I drive myself. So.
Okay, all right. And where do you get your medications?
Kroger.
All right. And do you have any problem getting your medications?
Just the lines of the people.
Okay, all right. And you'll follow up with Dr. Melvin, and at your time of discharge, we'll make sure that we have appointments set up for you.
Okay.
Okay? Any reason for us to think he's got any kind of core measure?
Nope.
No, okay. Any need for a pneumonia vaccine?
Yeah.
Do you have the chain of care?
I'm on call this afternoon, so Mr. Jones, when we're coming around again with rounds, it'll be me, and if you need anything this afternoon, the nurses can just page me, and I'll put that in the computer.